Hello and namaskar everyone. I'm Divya, your host, and welcome to today's live session of eGlobal Doctors. Thank you for joining our live session. We are live on Instagram, Facebook, Twitter, LinkedIn, YouTube. So hop on your favorite social media and let us know your questions in the comment box. Moving to today's topic, as we all experience dandruff at somewhere in our lives. So in today's session, we are going to explore about dandruff and anti-dandruff shampoos with our expert, Dr. Lata Rijhwani. She is here to advise and guide us about the dandruff. Welcome, Dr. Lata, to today's live. It's really nice to meet you. How are you doing today?
I am good, Divya. Thank you so much. Good morning to you. And thank you so much for having me on this platform once again.
Thank you. And pleasure is all ours because whenever you come, we get loads of information. So, Dr. Lata, can you introduce yourself to our viewers?
Yeah, sure. Hello, everyone. I am a dermatologist practicing currently at Jaipur. And before this, I was working for the Ministry of Health in Kuwait for more than 10 years. And I have done my post-graduation in pediatrics from R&T Medical College, Udaipur. And after that, I did my postgraduate diploma in dermatology from Cardiff University, UK. And since then, I've been practicing as a dermatologist, and my special fields of interest are pediatric dermatology and general dermatology.
Thank you, ma'am. It's always a pleasure to have you in our live sessions. You always bring so much knowledge and expertise to our viewers. Dr. Lata, what do you say? Without any delay, should we dive into the session?
Sure.
Yeah. So starting with a very basic thing, I think we all have experienced dandruff in our life. So I will start with a very basic question. What is dandruff?
Yeah, as you rightly said, Divya, and we all have gone through this condition once in our life at least. It is very common. And to put it simply, dandruff simply means scaling or flakiness of the scalp. So whenever you feel that your scalp is itchy, you are getting some small scales and you can actually see them on your clothes. So this condition is known as dandruff. And before we dip into the details, this is the basic, yeah.
Okay, at least I know what dandruff is. So Dr. Lata, what does it look like?
Yeah. As I said, dandruff can be most commonly, people notice it when it falls, on your clothes, or you can notice it on your head as white small scales. But it can, to put it simply, dandruff can look like two ways. Like people can experience having dry dandruff, which is due to dry scalp. You can feel a white powder shedding off your scalp. Then there is another kind of dandruff, which is thick and greasy and it sticks to your scalp. It is yellowish, it is very stubborn, hard to remove. And basically this kind of dandruff is more of a result of a fungal infection. So let me tell you in detail about this, that we all have a fungus known as Malassezia furfur, which is lying in the scalp all the time. And all of us have bit amount of dandruff, or you can say shedding of scalp, which is normal. But due to certain conditions or aggravating factors, when this fungus multiplies in our scalp, it leads to excessive inflammation in excessive cell production. And sometimes it gets infected also with bacteria. And then is the time when we notice a lot of shedding and the scaling, the greasiness. And this is how the dandruff develops. And this is when it is bothersome actually.
Okay. Dr. Lata, you told about the dandruff and what does it look like? So what causes dandruff? Like what triggers it?
Yeah, as I said, it is basically a fungal infection. And fungal infection, or I can put it the way that whenever excess oil meets with a fungus, because the fungus thrives very well on this oil and it produces an acid in the scalp. And then this acid leads to itching and irritation of the scalp. And that is how it presents. And talking about the aggravating factors, I mean, what causes this fungus, which is simply lying in our scalp without any harm, what causes this to trigger, this entire process It could be several factors ranging from excessive oily scalp, which can either be due to improper or infrequent shampooing. It can be your basic nature that your oil glands are very active and they produce more sebum, which could be genetic, like some people have oily skin, and similarly they can have oily scalp also. Then there are some hormonal changes, like during puberty, when your oil glands suddenly become active, then is the time which leads to acne and then again dandruff. Then there are stress is a very important cause which can aggravate dandruff. If you already are prone, it can be more. Then some nutritional imbalances, like especially youngsters who are depending more on the junk food and high carb food, that again gives a very good food for the fungus as well. And so it thrives and it proliferates in your scalp. Then there are some nutritional deficiencies which can lead to excessive amount of dandruff, especially vitamin B and zinc deficiencies are the one which should be looked into. Then as I told you that the improper hair care routines, either using faulty products or infrequently washing or even excessively washing, like people who have dry dandruff or those who suffer from dry scalp, they over shampoo, or they must be using very hot water during their shower. So this all strips off the oil. So basically both things, either too much shampooing or too less shampooing, too much oil or too less oil in the scalp, all of them can present as dandruff. So these are the factors and there are some medications and some diseases also that can lead to excessive amount of dandruff.
That's wonderful. I got to know very important thing. So I want to ask one more thing. Like you discussed about aggravating factors of dandruff. So that means dandruff might lead to acne also.
Yes, both these conditions, because their basic pathology is the excessive production of sebum, and inflammation of pilosebaceous duct is the main pathology of acne again. So most of the times when people come to us with acne, most of the times, like 70-80% of the times, they have dandruff, and interchangeably is also true. Those who have dandruff, especially the youngsters, the teenagers, unless the cause is something else, they also tend to have acne. So these are interrelated.
Okay, that's wonderful. So Dr. Lata, as हमें कभी भी कुछ होता है तो जनरली हम घर पे ही ट्रीट करने की कोशिश करते हैं. So are there any home remedies that might help to treat it?
हाँ जी, मोस्ट ऑफ द टाइम्स हमारे यहाँ आने से पहले स्पेशली स्किन कंडीशंस में लोग बहुत तरह की होम रेमेडी हैं, और इट्स नॉट दैट वो सब नहीं काम करते, सम ऑफ देम डू वर्क. और डैंड्रफ में स्पेशली जो लोग जिनको बहुत सीजनल डैंड्रफ रहता है, देखिए डैंड्रफ भी एक है कि एक तो क्रॉनिक हो गया कि हमेशा रहता है, इट्स देयर ऑल थ्रू द ईयर, हमारे बाल तो कभी साफ ही नहीं होते. एंड देयर आर सम पीपल जो बोलेंगे हमें सिर्फ विंटर में होता है, बारिश में होता है, फिर वो ठीक हो जाता है. सो इस तरह के लोग जिनमें माइल्ड डैंड्रफ है या विच इज रिलेटेड टू सीजनल चेंजेस या विच इज टेम्पररी, तो उस केस में कुछ होम रेमेडीज दे डू वर्क. और उसमें से जो कॉमनली अगर मैं कहूँ जो साइंटिफिकली हमें लगता है कि क्यों काम करती हैं, उसमें एप्पल साइडर विनेगर is one, जिसको ट्राई कर सकते हैं. मिक्स इट इन इक्वल अमाउंट्स ऑफ वाटर and you can either spray it with a spray bottle अपने स्कैल्प में, और you can even apply it. उसी तरह नहाने से थोड़ी देर पहले लेमन जूस also mixed with water. ये सब रेमेडीज देखिए तभी जब आपको माइल्ड डैंड्रफ है, सिर्फ आपको हल्का फुल्का, यू डोंट हैव एनी इचिंग इन्फ्लेमेशन. दिस डज नॉट अप्लाई फॉर केसेस जिनको बहुत खुजली है, इतनी कि कई लोग बोलते हैं हमारा ब्लड आ जाता है, वी हैव अ oozy scalp. So please don't try all these remedies when you have such extreme dandruff. But yes, for mild जो है उसके लिए आप try कर सकते हैं. There tea tree oil works very good if you mix it with coconut oil, few drops of tea tree oil. It also works very well for dandruff. And उसके अलावा नीम ऑयल भी कई लोग यूज करते हैं. एंड मैं तो यही कहूंगी कि सिंपली फॉरगेट अबाउट अदर थिंग्स. अगर 1 घंटा शैम्पू से पहले आप गुनगुने प्लेन कोकोनट ऑयल से मसाज करते हैं, any kind of dandruff you have, it soothes and it provides an anti-inflammatory effect, आपकी सर्कुलेशन को बढ़ाता है. और स्पेशली वो लोग जिनको वैसा डैंड्रफ है जो चिपका रहता है, कुछ लोग बोलते हैं हमारे तो डैंड्रफ चिपका ही रहता है स्कैल्प से, तो what the massage does it that it dislodges those thick scales. तो आप 1 घंटा पहले अगर अच्छे से उसको डिसलॉज करेंगे तो व्हेन यू शैम्पू इट विद एनी एंटी डैंड्रफ शैम्पू, द स्केल्स विल वेरी इजीली शेड ऑफ. So these are few things and they work quite a lot of times. They work for mild dandruff.
Okay, Dr. Lata, you mentioned about the coconut oil. So
Yeah.
is it okay to oil my hair if I have dandruff?
Yeah.
And if yes, so what oil? Yeah. If yes, so
very
what oil?
commonly
Yeah.
पेशेंट्स ये पूछते हैं आजकल ऑयलिंग के बारे में. लाइक व्हेन वी वर यंग, ऑयलिंग वाज यूनिवर्सल. एवरीबडी हैज टू ऑयल देयर हेयर एंड वी वर नॉट नोइंग कि ऑयल नहीं भी किया जाता. बट यस, इसके बारे में मैं देखिए कुछ बात कहना चाहूंगी कि मेनी डर्मेटोलॉजिस्ट दे नाउअडेज दे से डोंट ऑयल योर हेयर. बट कई पेशेंट्स भी कहते हैं, सी व्हेन यू हैव ड्राई स्कैल्प, देयर आर सम पीपल हु हैव, जैसे ही विंटर आएगी स्किन की तरह उनका स्कैल्प भी ड्राई होगा, दे विल हैव इचिंग, दे विल हैव फ्लेकिंग. उन लोगों में तो डेफिनेटली यू हैव टू ऑयल योर हेयर ट्वाइस अ वीक, दैट इज गुड इनफ. और जिनमें दूसरा ऑयली स्कैल्प है बट डैंड्रफ होता है, उनमें भी मैं कहूंगी कि ऑयलिंग करें आप, जैसा मैंने कहा, बट डोंट लीव इट फॉर लॉन्ग टाइम, because then the fungus gets a food for multiplication and उससे और आपका aggravate हो सकता है. But if you are doing it just once or twice a week, which is before shampooing, the best time is 2 hours before shampooing, and then wash it properly with a shampoo whichever suits you, then I think oiling definitely helps. It increases the blood circulation, and I am in a favor कि oiling करनी चाहिए, but don't leave it, do it in a right way.
Okay, that's wonderful to know. So moving to our next question, if I have dandruff, when should I go to a dermatologist?
Yes, Divya, you have very rightly put this question, क्योंकि कई बार ये होता है कि जब पेशेंट्स हमारे पास आते हैं उनका कंडीशन बहुत ही खराब होता है. आई मीन इट्स वेरी सिवियर. लाइक तो कई बार ये होता है कि डैंड्रफ को घर में ट्रीट करते हैं बिना ये जानते हुए कि ये डैंड्रफ है भी कि नहीं. सो व्हाट आई वुड सजेस्ट इज, अगर आपको ओकेजनली डैंड्रफ रहता है तो आप कुछ होम रेमेडीज ट्राई करिए. कुछ ओवर द काउंटर एंटी डैंड्रफ शैम्पूज भी हैं विच कैन हेल्प. बट अगर आपको लग रहा है कि मैंने ये कुछ टाइम कर लिया है बट स्टिल आई हैव गॉट स्टबर्न डैंड्रफ विच इज नॉट गोइंग ऑल द टाइम, स्कैल्प इची है, इन्फ्लेम्ड है आपके दूसरे साइड्स भी. सी व्हाट हैपेंस इज कि डैंड्रफ सिर्फ सर में ही नहीं, व्हाटएवर जो भी हेयर बियरिंग एरियाज हमारे बॉडी के हैं, स्पेशली द आईब्रोज, even the eyelashes and beard area in men, chest में, back में, जहां जहां भी बाल होंगे वहां ये डैंड्रफ हो सकता है. सो इफ यू नोटिस कि ये वहां से ज्यादा बढ़ रहा है, वी कैन नोटिस इट इन अदर एरियाज, दैट मीन्स अब आपकी जो सिवियरिटी है, नाउ फ्रॉम डैंड्रफ आप यू हैव प्रोग्रेस टू सीबोरिक डर्मेटाइटिस इज अ कंडीशन विच आई एम टॉकिंग अबाउट राइट नाउ. तो उस तरह के केसेस में, या फिर बहुत थिक स्केल्स हैं, तो उसको आप घर पे ही मत ट्रीट करते जाइए, बिकॉज इट इज वेरी इंपॉर्टेंट फॉर द डर्मेटोलॉजिस्ट टू डायग्नोज नाउ कि ये डैंड्रफ ही है या कुछ और है जो डैंड्रफ जैसा दिखता है. See, for a lay person, any scaling of scalp is dandruff, but actually it is not. So अगर आपके घर में ये सब नहीं हो रहा है और जैसा मैंने बताया, you have too much itching, so don't experiment. You can visit the expert. That is always the best.
Okay, so viewers, if you're having severe dandruff, you should always see a dermatologist, right? So that's great to know, Dr. Lata. Viewers, before moving to today's topic, I want to let you know that eGlobal Doctors Digital Health Hospital is coming up with a new feature called eGlobal Ayush. This project is for Indian folks working in USA, UK, Australia, Europe. Do you worry about parents back in India? eGlobal Ayush packages will help provide medical service needs for NRI patients in India. For more information, make sure to visit eglobalDoctors.com. eGlobal Doctors is a go-to for expert medical advice anywhere, anytime. Our digital hospital connects you with experienced 400 plus board certified doctors online, providing quality care and consultation without having to leave the comfort of your home. Moving to today's session, viewers, we are exploring and providing information about dandruff and anti-dandruff shampoos with our expert, Dr. Lata. We are live on Instagram, FB, Twitter, LinkedIn, YouTube. So hop on your favorite social media and let us know your doubts in the comment section. So Dr. Lata, as we discussed about the dandruff, what does it look like and what are the causes? and how to home remedies help us. So I want to ask, there are thousands of brands of anti-dandruff shampoos in the market, right? So how do I will know what shampoo is good? So what ingredients should I look for while buying an anti-dandruff shampoo?
Yeah, Divya, that's a very good question because as you said, there's a big, you have a lot of choices. But
Yeah.
before choosing an anti-dandruff shampoo, as I said, make sure from your doctor that you don't have any other condition, because there are many other conditions like psoriasis and seborrheic dermatitis. As I mentioned, there are some allergies to hair dyes or other chemicals which have to be ruled out. And but in case you have mild dandruff, you can go for, see, this common, as I said, it's basically dandruff is a fungal infection. So whenever you look for a brand, the commonly found ingredients will be zinc pyrithione, which is one, which is also known as ZPTO. And everybody, I think, is familiar with this ingredient. So there are many good brands, and most commonly Head and Shoulders. I think everybody has used it one or the other time. So ZPTO is one which is not only an antifungal, it is also antibacterial, and zinc pyrithione is also has a moisturizing effect. It soothes and calms your scalp. So this is how ZPTO will work. Then again, very common ingredient of most of the anti-dandruff shampoos is ketoconazole, which is again an antifungal agent, and it helps in reducing the proliferation of the fungus, and this is how it helps remove the dandruff. The next common is selenium sulfide, which is commonly found in shampoos like Selsun Blue. Selenium sulfide, again, it's a very potent antifungal agent. And then if plain antifungal shampoos do not work, like for those people who have very high buildup of cells, like they have too much dead and thick scales coming out, too much of dead skin, too much shedding, in those cases, we should look for shampoos which have keratolytics like coal tar and salicylic acid. And there are some shampoos which will have both coal tar and salicylic acid. Then there will be some which will have ketoconazole with salicylic acid. So depending on what all ingredients are required for your kind of dandruff, because salicylic acid and coal tar, they will prevent the excessive pileup of cells. They remove the dead cells from your scalp. So all these ingredients, they work in different way, and that let your dermatologist decide that what is the condition of your scalp. So before going for coal tar, salicylic acid, of course these are prescription based shampoos, and commonly Neutrogena tea gel shampoo which has coal tar, Neutrogena tea sal. So these are some common brands which have these shampoos. Then in India we have a lot of herbal shampoos also. In
Yes.
herbal shampoos, you should look for ingredients like tea tree oil, as I mentioned earlier. Tea tree oil, then neem is a good ingredient. Neem, amla, tulsi. These are some ingredients in some herbal shampoos which also work very nicely as an anti-dandruff agent. So these are the common ingredients. Then, of course, as a dermatologist, sometimes when the inflammation is too much and people are saying we are itching, हम तो सारा दिन सर खुजालते रहते हैं. In those kind of patients, हमें कभी-कभी steroid based. There are some shampoos which have mild steroids, anti-inflammatory effect करते हैं. They also provide immediate and very good relief. Then there are some moisturizing shampoos along with ZPTO, like there is Dove Derma Care shampoo, which has both of it has ZPTO, it has shea butter. So they not only moisturize, they also give an antifungal effect. So these are the common ingredients you should look for when you buy a shampoo. And when they don't help, then of course you have to take a prescription based shampoo.
Thank you so much, Dr. Lata, for providing such a useful information. I always used to buy Head and Shoulder whenever I get dandruff,
Yeah.
but you did not mention about that shampoo. So, Dr. Lata, how do these anti-dandruff shampoos work?
Yeah, depending on ingredients, Divya, as I told you, the most common ingredients being ketoconazole, and nowadays we have other azole shampoos in market, like laliconazole shampoo has also come. Then there are various combinations. See, basically we need a good antifungal agent whenever you have dandruff. If you have very dry scalp with dandruff, we look for more of moisturizing ingredients which provide a soothing effect, calming effect, which are anti-itching, anti-inflammatory. In that case, ZPTO based shampoos, they work very well. And of course, antifungal component is a must. And sometimes we feel that the patient needs more of a keratolytic, like there is less of fungal component and there is more of cell buildup, and too much, the cell is renewing on a increased rate and they have too many dead cells. In that case, we prescribe coal tar or salicylic based shampoos. So they all work in a different way, and sometimes it is best to give combinations so that all the ingredients they work, and they every aspect of dandruff is taken care of. Because every time people have mixture of one or two, I mean, you can't say 100% it's a fungal or it's a and there is more of the keratolytic component is needed. So it is always best to best left to a dermatologist to judge.
Yeah, thank you, ma'am. We have one question on FB. So how the viewer is asking, how often should I wash my hair to help manage my dandruff?
Yeah. Once or twice a week should be good enough. See, when we prescribe an anti-dandruff shampoo, we always tell our patient to apply it twice weekly. I think that more than the frequency, the way you apply an anti-dandruff shampoo, it is very important. Sometimes हम patient को देते हैं और वो उसको कई बार रोज ही लगा रहे हैं. They think कि उसको रोज लगाएंगे तो हमारा dandruff जल्दी ठीक हो जाएगा, but it's not like that. See, always read the instructions carefully when you use an anti-dandruff shampoo, because sometimes the contact time is mentioned. Kuch shampoos ko aapko 5-7 minute rakhna padta hai. I mean, you can't just wash away with an anti-dandruff shampoo pure balon mein laga liya. No. It has to be applied on your scalp. It has to be applied on the roots. It has to be left for some time. In some shampoos now they say that you can wash off immediately, but most of the times the shampoo to act, it will need some contact time of at least 3 to 5 to 7 minutes. Rinse it off, and then you can, if you have long hair, you can use another shampoo on the top. That's fine. But to start with, twice weekly is good enough. But yes, if depends again, if you have very oily scalp, you are working outdoors, you are staying in tropical weather, you have a lot of humidity around you, and so of course the frequency should increase. So it all depends on how your scalp, but the point is that scalp has to be clean, and the anti-dandruff shampoo you can use twice. And then if you want to use a shampoo other than that, like if you want to increase the frequency, you can use your normal shampoo for washing, or you can even rinse the scalp. Like if you're doing gym, you are sweating, and you need not shampoo every day. You can just simply rinse your scalp with water.
So whoever has asked this question, I think they have got their answer. So, Dr. Lata, we talked about the dandruff, their causes, home remedies, and anti-dandruff shampoos. So, is there any other treatment options for dandruff, or any prevention tips for that?
Yeah, see, Divya, the anti-dandruff are the mainstay of the treatment. Like as I said before, coming to us, patients have already tried 1 or 2 brands of anti-dandruff shampoo. But then if the dandruff is stubborn and it is not dandruff, it is something else. It is seborrheic dermatitis, it can be allergic contact dermatitis, it can be psoriasis, which looks like dandruff. Then there are certain other options, and we can use some stay-on lotions. Like we have some anti-dandruff ingredients in the form of stay-on lotions, like you have to apply them for an hour or maybe half an hour before shampooing, or sometimes you can leave them overnight for them to act, and then you can rinse it off the next day. So some leave-on lotions are there. Some lotions which are a combination of antifungal with steroid-based medication. See, when the inflammation increases to an extent that it has become very itchy and irritating, we might use those. And even if these don't work, then we can give some oral medications also to control dandruff, oral antifungals also. Sometimes in very severe cases, we may have to prescribe them also. So these are the other, yeah.
That's
and as you
great.
said, your second part of the question was prevention. See, if you ask me, there is a long-term, is there a permanent solution for dandruff? I would say yes, and I would say no. See, most of the times when you come to us, we give you treatment, then we put you on maintenance therapy. For example, the lotions or the shampoos from twice weekly, we switch to once weekly. Then we tell you, okay, off and on you can use them. But then I want to emphasize that lifestyle changes, as I always emphasize in all my videos, that they are equally important. That how you maintain your healthy scalp. That is that you have to eat healthy, you have to eat a balanced meal, you have to increase your water intake, you have to exercise regularly so that the circulation of scalp remains okay, and you have to use a proper hair care routine and proper oil massage or whatever products you are using, you have to use them mindfully, and so that the dandruff doesn't become a permanent problem. So see, it is very much related to stress and nutrition and the hormonal imbalances and the way you take care of your hair. So if you follow all these things, I'm sure that it won't be a chronic or permanent disease for you.
Yeah. Thank you, Dr. Lata. Viewers, if any one of our viewers has joined late or they did not get to know about the topic, here we are providing the gist of the today's lecture. So, Dr. Lata, can you summarize to our viewers like what we have discussed?
Yeah. See, to summarize it, dandruff, everybody knows what is dandruff, from a child to an adult. All of us have experienced this in any point of time in our life. We have always experienced, but I would say that just treat it at your home. As I told you, there are some tips. You can take care of your hair so that dandruff does not occur if it has occurred. And if you think that this is something more bothersome than simply some mild scaling, visit an expert, follow proper advice, follow proper diet. And this is a very common condition, but then yes, it is not that it is not treatable and you have to live with it and you have to ignore it. So everybody deserves a healthy skin and healthy hair. So I would just say that take care of yourself.
Yeah. Thank you, Dr. Lata, for providing such useful information about dandruff and anti-dandruff shampoos. It's always an honor to have you. You always provide so much important information to our viewers. All the viewers, if you need any help or guidance for your skin and hair, you can connect to our Dr. Lata on eGlobalDoctors.com. Before ending this session, let me tell you to all the viewers that eGlobal Doctors has different diet plans for you, which can reverse your health conditions like diabetes, PCOS, thyroid, weight loss, and weight gain. 3 weeks and 3 months plan are available. You can visit eGlobalDoctors.com for more details. eGlobal Doctors have partnered with Shigar Pharmacy to deliver medicines to the people of Metro Atlanta local community. This service is not available to patients outside of Atlanta at this time. So viewers watching us on different platforms, do comment below on what sessions you would like to see Dr. Lata. And don't forget to like and share the session. So Dr. Lata, thank you so much for providing these informations regarding dandruff. Thank you everyone, whoever joined this session. Thank you, Dr. Lata. So it's the
Thank you so much, Divya. It was my pleasure and hope to see you again.